much as I've worked a lot in the public sector, you are looking at a person now as private sector. So why private sector in this? And why am I convinced that private sector is very important in this relationship, agriculture, health and nutrition, or agriculture, nutrition and health? Private sector overall is very important and has different functions at different points, from production all the way through marketing to the consumer. And the private sector, they are very efficient in what they are doing. They are very innovative. They also look at quality management. They have consumer insights. People were talking of behavior change. The private sector are very good in convincing somebody to change their behavior and start using a certain product or behaving in a certain way, even if maybe it's not good for their health. But that shows that the private sector have this strength of changing behavior. They always have compelling messages that even if you didn't want to follow, you end up following. And they have multiple communication channels. They reach wide coverages and different networks. Now, in this relationship, we have to take these strengths and see how can we utilize them. Now, in this session, I'll try just to highlight a few positives. I know that overall, the private sector in agriculture, I think the agriculture sector appreciates more the role of private sector. They're involved all the way, maybe from the research, even in seed, distribution, the technologies that they're using in agriculture, different types of roles that the private sector is using. However, as we come towards health and nutrition, sometimes there is mistrust that do they really have a nutrition objective, or it's just a marketing objective so that maybe people can buy their products. So, and also we have some policies, some resolutions that are global, some are national, that sometimes people misunderstand them. For example, we have the Code of Marketing Breast Milk Substitutes. Sometimes people think that the private sector cannot be involved in complementary feeding, for example, because they will undermine breastfeeding. Or people will stop using the available foods in the communities and jump into maybe the complementary foods that have been produced by the private sector. However, today, let us look at this positively and see how can we, using policies, using programs, how can we make sure that we benefit from these roles that they have, from these strengths that the private sector has. Now, from agriculture, in the morning we talked about biofortification. They're also good in that, and they really help. So general food processing, value addition, addressing nutrition concerns. Both under nutrition, they're able to increase the energy and specific micronutrients into the food. At the same time, the private sector is also able to deal with diet-related non-communicable diseases. They will produce low-fat yogurt for you. They will do that, for example. They will produce 2% milk for you if you don't need a lot of fat in your diet. At the same time, they'll give you full cream milk, for example, if you really need all that fat or if you really need all that energy in your diet. They'll produce supplements. They produce medicine. Most of these medicines that we have, they come from agriculture, and the private sector has really played a part on this. Even simple things like people use moringa leaves, for example. We use it traditionally, but these days you see it in shops, packaged and all that. That is the role of the private sector. They normally sniff around what are the needs of the communities. Even if you don't invite them, they will grab some idea and run with it. Apart from that, let me try to give one example where the private sector is doing a good job and is trying to link production and then processing and then trying to deal with a health problem. And that is Valid Nutrition. I work for Valid. There's Valid Nutrition, there's Valid International. So as I said, I'm now a converted private sector. Valid Nutrition has the objective of producing highly nutritious, ready-to-eat foods. So they could be for treatment, they could be for prevention of malnutrition. And they want to make sure that they are available for people that really need them. Within that, they have a health objective to make sure that these foods do not transmit diseases. At the same time, they don't worsen some of the diseases. And then they follow all occupational health regulations that are there, and also do rigorous testing for quality assurance. They always use what is required. They use global requirements and what is needed. They started looking at how can we deal with severe acute malnutrition, and that's how, through Valid International, they were able to develop the community-based management of malnutrition. Now, they have some challenges, especially in sourcing the raw materials. For example, in one of the recipes, they use peanuts. And within peanut, the problems have been facing very low quality, very high aflatoxin levels. As such, they had to spend a lot in testing, and that was also exaggerated, or maybe the problem was really made worse by us Malawi having poor maybe testing mechanisms. You would go to Malawi Bureau of Standards, says, oh, this is okay, it's within the standards. You take the same product to another lab, it has very high aflatoxin levels, therefore you have to throw away. So things like those. So in that way now, Valid Nutrition works with peanut-based producers, works with farmers directly. And farmers have really responded well, saying that, fine, this is what you want, we will produce. And also, then there are like demand-driven extension services through Exagris, where they help farmers to make sure that they produce good quality paste and also observe good storage mechanisms to make sure we have very low aflatoxin. Now, overall on policies, the private sector normally observe countries' policies and programs. They do. However, you have to have good monitoring system. There has to be what we call a carrot and a stick. Don't always just use the stick. There has to be a carrot, meaning there has to be incentives. How good are our policies in importation? What about pricing? We want to export, for example. They can export these products, but it's so bureaucratic for you to even get an export permission for some of the ready-to-use foods, for example. Even to send to Somalia, you have to go through rigorous processes. And also, if somebody is producing or is fortifying, we talked about fortification, which is well known. When you're importing fortificants, for example, can the government put some policies, at least maybe tax exemptions, things like those? Those are the carrots I'm talking about. And also, if we sit together, we trust each other, we should be able to know that this is against the resolution. Here the labeling is not good, you are convening. So in other words, what are the impact of these policies that we have on the private sector. The private sector is willing, they have all these strengths, and we have the carrots that really can help. Thank you so much.